Gastric sleeve surgery is the most performed bariatric procedure in the world. It consists of making a small, thin tube in the shape of an inverted C that reduces the stomach from its usual size by 60 to 85%, depending on the original size of the stomach. The most important thing is not what we remove, but what we leave. Every person must have a capacity between 3 to 5 ounces. This will limit the amount of food that one can eat, and also decrease the presence of a hormone called ghrelin, which is responsible for appetite, and is mainly produced in the removed portion of the stomach. The gastric sleeve surgery is a minimally invasive procedure done through tiny incisions that allow the placement of trocars, through which the specialized instruments will pass to perform the surgery.
Ciba is renowned for being the only team that performs an endoscopy before and after surgery to ensure our exceptional care.
The initial endoscopy is to aid in determining if each patient is an ideal candidate to receive a gastric sleeve procedure. We use an ultrasonic energy tool called a harmonic scalpel to simultaneously cut and seal the stomach into its newly formed greater curvature, and when it is released, we confirm the calibration of the size of the sleeve. We also use high-tech staplers, which release 6 lines of staples to avoid leaks and bleeding. Then we reinforce the stapling line with an external suture on the stomach, remove the excess, and place a drain that will help us during the hospital stay to detect the presence of any complications and resolve them in the fastest and safest way. Finally, we perform the second and final intraoperative endoscopy. Here, we check the seal for abnormalities and confirm that the sleeve is straight. It is through this second endoscopy that we are able to rule out the presence of internal bleeding that could cause complications.